Hello, my name's Andy Haynes and I'm your Medical Director. In October's Board of Directors meeting, we had a lot of discussion about finance. It's really important that we balance finance, quality and performance. Paul Robinson and his finance team are working really hard and working with you to try and make sure that we do that. And that's the best way for us to make sure we continue to deliver great care for our patients. We had a really moving patient story from our rehabilitation team. A patient had a dog bite and as a result of the sepsis that ensued, had to have all 4 limbs amputated in some measure. An incredibly disabling event for him and a major life change. Seeing how the team worked with him, not just to manage his physical needs, but also his emotional needs, was truly inspiring. It's a real example of the care that we offer and how we work together as a multidisciplinary team. We also talked about flu jabs. It's an area close to my heart, having worked with cancer patients for many decades. This trust has a great history. We've achieved high 70% of flu jab uptake amongst our staff for the last 3 years, which is absolutely brilliant. We know that to reduce spread amongst staff as effectively as we can, we need to get over 90% vaccination rate. So I'm really interested to try and help people understand. We shouldn't be forcing people to have the flu jab, but where there's misinformation about the lack of effect or the risks of it, or that it doesn't affect younger people, it's really important we explore those and help people understand that really this is about protecting our patients. For me, one patient who catches flu from our staff and has an illness as a result is one patient too many. We've had a fantastic start to this year's flu campaign. We've vaccinated over 1,200 people. That's over 30% of staff in the first 2 weeks, which is absolutely brilliant. So if we can keep that passion going, please engage with the flu jab team when they're out and about and get a jab, and let's help protect everybody this winter as best we can. Sickness absence in August was 3.5%, which is around about the target we set and a significant improvement from 18 months ago. We continue to recruit well on medical vacancies, which is counter to the national position, and we've had success at nurse recruitment, and our turnover rate is significantly less than 1%, which is brilliant, but we all recognise there's still more work to do there now. On the back of the CQC report, we want to get as many people to join us now as we can. When it comes to quality, our performance has been quite consistent now for quite a long period of time. The number of Clostridium difficile cases is within range and we're on target to meet our annual target for the 3rd year. The number of falls has plateaued, and fortunately the number of falls with serious harm is very low, and that again is in a stable position, though we continue to do all that we can to prevent falls. Generally, our friends and family tests are showing increased response rates and very good recommendation rates, but we recognise there's still more that we can do, and we'd like to be amongst the best in class in terms of response rates. In terms of cancelled operations on the day, any of these are distressing for patients, so whilst our rate is in the range that we'd like it to be, we'd always want to be working to reduce that. So less than 1% of patients are cancelled on the day, but it'd be great if that was 0. In terms of access, it's a fantastic achievement that we've met the 95% target for the first 2 quarters of the year and consecutively for the last 5 months. That's a great effort by everybody all the way across the trust, from ED to the back door and our partners outside of the trust, and we hope to continue that level of performance into the winter. Part of the reason that's helped with that is that we've met our diagnostic standards tests. We give very rapid access actually both to emergency and non-emergency patients for diagnostic tests. We think cancer's really important, and we met all of our cancer targets apart from the 62-day target, which is disappointing. We have relatively small numbers of patients, which means the number's always volatile, but there undoubtedly are factors that we can control to make these pathways better. We will be working hard, both internally and with colleagues in Nottingham with whom we share many of these pathways, to make the experience of patients equal across Nottinghamshire and as the best it can possibly be. It is on the backdrop of a significant rise of over 30% in 2-week wait referrals in the last 5 years. So there is an increased demand, and overall we're picking up about 7 or 8% more cancers as a result, but managing the extra workload is proving more problematic for us. And now for finance. We've managed to meet our agency spend cap this month, and we're running at or about that cap. But clearly we're very aware that with winter coming, there is a risk that that could be affected by the need for extra agency staff to manage winter pressures. We're very aware that we have a financial recovery that's required for us to meet our financial position by the end of the year, though we still are predicting we'll meet our overall control total. That's the plan that we set with our regulators at the start of the year. To do that, we will need to improve performance on our internal financial improvement plan, and we're very open to suggestions. We're working very hard with divisions and corporate areas to manage the spend that we can, but if you have any obvious suggestions, please bring them forward either to myself, one of the other executive directors, or to Paul Robinson in finance, and we'll happily listen and see if we can develop those ideas. We know that there are areas of rework, overwork, and not doing things that we know work well in health. That would be true for every trust, and we really need to get into rooting out those things now. So things like colour printing are something that we've had control on in the past, and taxi spend. So it's the simple things that we need to focus on as well as the big things. And finally, just to close, the judging for the Staff Excellence Awards has now closed. It's been another brilliant year with some fantastic nominations, and we hope to announce the shortlist soon, but it's given people a real headache to make that judging. It's a fantastic credit to this trust, and we're really looking forward to that dinner in the early weeks of November. So we hope you found that useful. It's certainly a busy time of year for all of us. Look after yourselves, look after each other, and I hope that's been useful. Thank you.